Some local healthcare workers raising alarms about an issue they are calling horrifying and unethical. Despite being terrified they'll lose their jobs, they say they are coming forward concerned that you or your family are at risk at the region's largest hospital. And after our inquiries, the hospital now says they did have to cancel, delay, or relocate some surgeries as they work to resolve the issue. Chief Investigative Reporter Lauren Traeger has the report, Surgical Safety.
Every year, operating staff at Barnes-Jewish Hospital perform thousands of surgeries. But healthcare workers tell us in recent weeks they've been sounding an alarm of contaminated and dirty surgical tools. Pictures sent to us anonymously of brownish stains, dripping or splattered, rust or residue, even damage that experts say could cause infections.
It has been plain as day that some of these tools are potentially dirty or contaminated.
Yes.
First Alert 4 Investigates received a number of different tips, but whistleblowers were terrified they'll lose their jobs if they talk. One staffer asked we not even use their voice, but these are their direct quotes, as read by a First Alert 4 employee.
Do you think that patients have any idea this is happening?
I don't think so. And they could get infections that could kill them.
Sterile tools are an aspect of modern medicine we might take for granted. Every surgery requires a precise set of tools laid out in trays. Hospitals reuse their tools, so to clean them between procedures, they go through what is called sterile processing. It's often an entire department and a multi-step process: decontamination, cleaning, and usually high heat steam sterilization.
There are things that can be heated to like a really high temperature and be cleaned that way, which is fine, assuming that the machine works. The problem is it hasn't been working.
Barnes-Jewish Hospital reps declined our request for an on-camera interview. In a statement, they said, quote, consistent with our culture of safety, during the normal pre-surgery process, our surgical teams inspect all instruments to ensure they meet our high standards. Instruments that do not meet these standards are rejected and are not used. But at the beginning of December, staffers tell First Alert 4 Investigates they first started noticing a big issue.
Tray after tray after tray was showing up to the OR contaminated. One case alone went through over 30 trays trying to find clean instruments, and these were all things that had supposedly gone through the sterilizer.
Staff, this whistleblower said, have been instructed to use tools that appear clean to the naked eye.
We're not sure if the ones that appear to be clean are actually clean,
putting them, they say, in a very difficult position.
There's been a huge concern from the nursing staff and OR staff, surgical staff, everyone, that we're using tools that might not be fully sterile.
But tossing trays, they say, has led to massive backlogs and delays in surgeries. Some patients transferred to other facilities. This person on social media writing, quote, BJC St. Louis had some trouble with sterilization. So after days of waiting and a transfer, their loved one's open heart surgery occurred in Belleville instead of in St. Louis. In their statement, BJC Health acknowledged, quote, isolated shortages of surgical instruments, saying they did have to cancel, delay, reschedule, or move surgeries, saying they have addressed this with affected patients and, quote, apologized for the inconvenience.
Can those tools be used to operate on patients as is?
No. I would not use those.
We showed the pictures and shared staffers' concerns with Brandon Huffman, a sterile processing expert.
These different discolorations and bioburden is what we would call it, and rust on instruments is a big red flag that there's systemic issues going on.
Should patients be concerned about this?
Unfortunately, yes. I don't want dirty instruments used on my family, myself, anyone for that matter. So it's very important that it's clean and it's ready for use. And honestly, kudos to the OR staff that are calling this out, because we have to protect the patients at all costs.
Concerned staff did report the issue to the state health department. They tell us they investigated but found no deficiencies. Huffman wonders how in-depth the investigation really was.
So they'll come in, they'll ask a few questions, and then they'll leave because it's out of their wheelhouse.
The pictures and the words of the OR staff, he says, could tell a different story.
Do we think that maybe still warrants a further review?
Absolutely. We have patients' lives in our hands, and if we aren't giving it a thorough review, we're doing a disservice to our community.
Huffman says sterile processing issues are becoming more prevalent nationwide. Machines are expensive, he says, and sterile processing techs are in short supply.
It is something that is getting worse as the budgets are constraining.
BJC Health statement says, quote, "We have purchased additional instruments and equipment and made modifications and improvements to resolve this matter." Still, hospitals in Colorado and Vermont last year paused surgeries over sterile tools concerns. Whistleblowers wonder why Barnes Jewish Hospital hasn't done the same.
Do you think that the hospital should have just been out and out canceling surgeries or sending elsewhere to major hospital systems?
Yes. Yes.
Not confident their tools for surgery are clean, they say they're worried for their patients.
It's not safe, and I don't think it's ethical.
In their statement, BJC said they are proud of their culture of safety and said, quote, "Our focus remains on providing excellent care for our patients in a safe environment with the support of our care teams." We did provide those pictures to BJC Health, which they did not comment on specifically, and we asked for additional information as well. They did decline to tell us what exactly is causing the instrument shortages, but they said that with few exceptions, surgery schedules are back to normal. They say this, quote, "isolated concern affected less than 1% of their 46,000 surgeries every year, but that is 400 or so surgeries." We also asked about surgical site infection data. They told us their current rates are in line with years past. We've requested that data from federal regulators as well, but we are waiting to hear back. If we have additional updates on this, we will certainly bring them to you. I'm Lauren Traeger, First Alert 4 Investigates.
Experts tell us, like anything related to your health, you should feel empowered to ask questions about sterile processes before you or your loved one has a surgery.